This is the world's smallest pacemaker. If you don't believe me, keep on watching. Hello everybody, welcome back to my channel. If you're new here, my name is Amrisha. Welcome to my week in cardiology. We are back in the airport, guys. If you did not get that reference, go watch this video. We were meant to have cardiology and neurology one week after the other, but we missed the first week. They slotted us in now. I'm so grateful we actually get this week. So today is actually Wednesday. We were meant to come yesterday, but it was Human Rights Day, which is a public holiday in South Africa. So just like in neurology, we got a timetable for the week. We missed the introductory lecture yesterday, but scheduled on the timetable for today is clinic at 8, ward rounds at 2, and a tutorial at 2:30. So in the cardiac clinic, we have 2 or 3 members per consultant. And once the patient is examined, we discuss their condition. And since this is the cardiology department, we perform and interpret a lot of ECGs. Most of the patients in the clinic have had valve replacements and are coming for their regular checkups.
You're seeing all the random spikes everywhere. Then that's generally because of a pacemaker. Before the contraction.
Of the ventricles.
Yeah. Because you're seeing it before the QRS.
Out of the 10. If you know me, you know that I strongly dislike getting my blood pressure taken. But I was willing to be the guinea pig since we need the practice for our clinical exams, which are coming up shortly. So measuring the blood pressure of a patient is part of the vital signs when doing a general examination, of which included are checking the pulse for the heart rate, counting the number of breaths per minute for respiratory rate, as well as taking a temperature. What did you get? 172.
We did CCF, congestive cardiac failure. We also did some ECG interpretations.
What did you see on the ECGs?
Oh yeah, the patient had ischemic heart disease, right? And also other things that we saw. I think we'll feel asleep.
We also learned about M-STEMI and M-STEMI. Yes. So in M-STEMI, they told us that a patient later will have pathological cues, which represents dead tissue or infarction. Yes, and M-STEMI, they don't show pathological cues. Yeah.
Interesting. And what is the time now?
10 to 1.
And this is the time we're going for lunch.
Obvious.
There's a cafe near the entrance of the hospital, so I got a hot, and let me emphasize the hot part of a hot chocolate. Because as soon as I sat down at the table, the lid slid off the cup because they don't have the right size, and everything fell. But on the bright side, there was still some left in the cup, so I could still drink some. So we are finished with day 1 of cardiology, and my hands dried. We went for ward rounds from 2 to 2:30, and then we were meant to have a tutorial, but she postponed it to tomorrow. So I had some time and I went to clerk some patients. Just as I was coming out, one of the patients that we saw on the ward round earlier, just like, Baboolall, come here for a second. I was like, okay. So apparently she was on the board of Greenbury High School, where my mom used to teach about 20 years ago. My mom actually taught her son life science, and he's now in Taiwan. He's 33. So she remembered my mom after so many years ago. We had a little catch up on our lives, and it was so nice meeting her. Funny how life is, you just meet people. So that was a cute little encounter. I quite like cardiology. We attended the clinic from 9 to 1 p.m. Examined patients with pacemakers. This other doctor showed us a video of what a vegetation looks like on the valves on an echo, and you can actually see it as the valves open and close. This big thing that's flapping up and down with it. It looks like a ball that's stuck to the valve. So you would see that in infective endocarditis because he was explaining juice criteria. So he showed us what vegetation looks like. Then we were meant to see a stress test, which is basically an ECG, but the person is on a treadmill. So they increase the speed or the incline, and it monitors your heart as it gets harder. the machine was broken, but it's basically the same as an ECG. It is after 4. मैं बहुत थका है और भूख लगी है. Let's hope Nani made some nice chicken curry and rice. I'm in the library. First tutorial scheduled on the timetable for today is at 11. Then we have another tutorial scheduled later on, as well as the one that was postponed from yesterday, which is at 2:30. We also have a dermatology lecture at 12. Yes, we are still doing that. However, the cardiology administrator did tell us yesterday that the 2 tutors who were scheduled for today both might not be available, so we're just gonna see how it turns out.
Okay, we went via the terminal artery all the way up the iliacs, the abdominal aorta, around the aortic arch, and the coronary artery comes out from the aorta.
We are now in the cath lab, and this is live footage of an angiogram being done. So this patient came in with an anterior infarct. Right now they're trying to visualize the lesion on the left anterior descending artery. For this procedure, you insert the catheter through the femoral artery, which is in your groin area, so it travels all the way up through the iliacs, abdominal aorta and arch of aorta, so that the injected dye can reach the coronary artery. Furthermore, she moved it into the left ventricle and injected a much higher contrast, making it more potent as seen in this new imaging.
Hot summer, so hot. I wanna build a time machine so I can go back to July. Hot summer, so hot. No shoes, no shoes.
Bright and early Friday morning, we were surprised by a spontaneous presentation which we did not know was happening because the only thing scheduled on the timetable for Friday was ward rounds at 11. The entire cardiology department were in attendance. We were extremely lucky that the company Phillips came to do their presentation in the same week that we had cardiology. Hence, we got to see the new equipment that they were proposing for use in angiograms called the Omniwire, as well as hold the world's smallest transvenous pacemaker in our hands. The advancements in the technology of the Omniwire was quite impressive in terms of futuristic equipment.
Introducing the Phillips Interventional Applications Platform. Smart, simple, seamless.
I mean, it can be a dissection, it can be calcium, it can be thrombus, it can be stenosis. With others, you can determine what you're looking at, and that will guide you in your treatment.
Components have a lower pull rate than any other of your competitors, and that's and the chance of AF. So generally, what we see.
We went to have lunch and we came back. We attended ward rounds and now we're done. It is 1:15, so it is time to go home. When Nani and my sister arrived, we had lunch with a family friend, and she's actually the head of oncology at this hospital. So it is 3:15 and now we're going home. Didi, let's see those highlights. Nani, you had a nice day today. Yeah. That is the cardiology week. Even though it was just 3 days, we did so much more than expected. So super grateful that we got to have this week. If you are not subscribed yet, subscribe, like this video, share it with your friends. Let's hit 1,000 subscribers. If you are watching this and you're not subscribed, go do it right now. What are you doing? Go hit the button right now. So yeah, as you can see, we're wearing pink for cardiology. I hope you enjoyed. I will see you all in the next one. Bye.